Periodontal plastic surgery, as coined by Dr. Miller, traditionally has to do with surgical treatment of gingival defects around teeth. Procedures such as aesthetic crown lengthening, to me, are the surgical version of sculpture. It's artistic, yet rooted in the biologic realities of the gingiva, the connective tissue, and bone. But with the development of dental implants, the expectation of a certain level of aesthetics on par with the natural dentition has resulted in an evolution of the procedures we apply to recreate natural aesthetics. In my practice and many others, the terminology has evolved to the more encompassing term of oral plastic surgery. And this right here is where the restorative and surgical comes together in implant dentistry, the development of the emergence profile that determines the aesthetic success or failure of the final restoration. So for the few minutes that we have together this afternoon, I would like to discuss risk assessment as I apply it in my practice for the surgical enhancement of the soft tissue profile. So let's use these images as an introduction to illustrate what we'll be discussing today. This first image is of my patient Anna, following aesthetic crown lengthening procedures. This is the picture of Anna before the treatment was completed. And then using Photoshop, I have created a slight recession on tooth number 9. So let's pretend that Anna will be losing tooth number 9 in all 3 scenarios. I hope that you can all appreciate that each scenario creates a different set of circumstances that have to be managed by the surgical and the restorative team. Let's put the tooth right back and take out the lateral incisor number 7. Again, the gingival defects apparent on the pictures on the end also have to be managed in order to obtain a complete aesthetic result for our patient. I believe it's important to look beyond the implant site to fully address every patient's aesthetics, regardless of whether you're a surgeon or a restorative dentist.